What's going on, guys? Ilya here with another short video on how to get diagnosed with Epstein Barr virus. Now, it's not that I'm wishing you to get diagnosed with EBV, of course not. I just want to share my experience in terms of what lab test exactly I passed through to get diagnosed, what are the different approaches to diagnostics. So if you're suspecting yourself to have this infection and you want to know what it is, or what it isn't, whether you have it or not, make sure to watch this video till the end. Now, before we start, also make sure to subscribe to my Telegram channel, because there's a text version of this video and of other videos in form of articles with a great level of detail, more experience of mine, etc. As well, we are trying to create a EBV/ME CFS chronic fatigue syndrome community in there. There's already a bunch of people there who are sharing their experiences, asking questions, just communicating, and trying to not feel so isolated in this state. So now the very first thing which I want to mention is that a qualified medical professional will look at a combination of symptoms, first of all, such as persistent sore throat in the absence of bacterial infection, like fatigue, like brain fog, low-grade fever, for example, that's a big one. Even by combination of that symptoms, that is already can be like narrowed down to some kind of acute or persistent viral infection. But we also need to understand that there are many known causes to what is called chronic fatigue syndrome. Most of them are viral agents like Epstein Barr virus. This is the thing we are talking much about on my channel. This is human herpes virus type 6. This is herpes simplex virus sometimes. This is cytomegalovirus and other infections. So it's believed that infection is a major trigger for ME CFS. But now the most important, and I just want to give you this thing right away in the video, the most important part of the diagnostics is checking for Epstein Barr virus antibodies. So EBV antibodies are produced, as we already know from the previous videos, they are produced from the so-called activated B cells, activated B lymphocytes. Under certain circumstances, starting to produce various types of antibodies to different compounds of a viral particle. So in terms of the lab tests, what you want to look for is viral capsid antigen, VCA IgM and VCA IgG. Then you want to test for Epstein Barr nuclear antigen, IgG, and for early antigen, IgG. So the first marker is VCA IgM. What you need to know about that one is that it's a sign of early or acute stage of infection, and it disappears in 2 to 4 months from the onset of infection. So if your IgM is positive, it's most commonly suggesting about the fact that you're having the early or the primary or the acute infection, like the very first stage of the infection. Well, now the second one, VCA IgG, is also, from the name you can get, it is viral capsid antigen. So basically this is the antigen which is aimed on destroying the capsid of the virus. Now, just like the VCA IgM, IgG one starts producing from the onset of infection, like from the early stages. But the difference to IgM is that it does not disappear over time. It just increases, its levels usually increase over time during the acute phase, during the convalescence, and then it just usually stabilizes at some point and remains basically for the rest of your life, right? That is why the positive VCA IgG is usually referred to as post-infection, because if you do have the VCA IgG, that means that you already have the immunity to Epstein Barr virus, your body have already encountered that infection. The third one is early antigen, early antigen IgG. So this one also appears in the early stage of infection, But the difference to prior to is that it disappears during the convalescence period, and then it generally stays negative if your immune system is okay, if you do not have this persistent viral infection. However, in some cases, it may indicate as positive in some moments of your life, identifying an active viral replication, meaning that in that particular moment of time, you have the virus reactivation. However, important thing to note is that, according to some data, in 20% of cases, early antigen IgG stays positive for several years after the infection onset, making such results false negative because they are not identifying the active viral replication or viral reactivation. In other words, it just stays positive for some reason in 20% of people, so you should remember that. Now the last one, EBNA IgG or Epstein Barr nuclear antigen. As you may derive from the name, it's an antigen which our body produces against the nuclear part of the virus. Okay. The tricky thing about this EBNA IgG antibody is that usually it appears positive after the week 3 of initial infection, or more generally, to speak more generally, after the acute phase of Epstein Barr virus has ended. And it constantly growing, levels growing, and it peaks somewhere at month 8, and then persist for the lifetime. And in this sense, it's much similar to this VCA IgG body right there, right? These two are staying positive throughout the life, and therefore they are usually used to identify the past infection. Now we know we have these 4 antibodies, but the question is what to test for. Do we need to test for all of them, or do we need some specific ones? I'd say, in my experience, in my personal opinion, I'm not a doctor, just to remind you, that you need to, or you would like to test for all of them each time. Most of the doctors, they're usually prescribing the VCA IgG. They are not prescribing VCA IgM most of the times because, like I said, it becomes negative after the acute phase ended, and most of the patients are coming with chronic fatigue syndrome-like symptoms, and the doctors understand that, okay, there was an infection, it was in the past, we don't need to test for VCA IgM because it's not an acute infection. So what the most doctors are doing is that they are just prescribing EBNA IgG and VCA IgG to check for the past infection. I'd say the better option is to go for all of them. Let me explain why. First of all, you can try to track or try to catch reactivation. Our early antigen EA IgG antibodies, which are identifying the viral reactivation, we can try to catch that one. And also generally, sometimes even VCA IgM becomes positive once again. I've encountered some people in different social media comments who suggested that they have this thing positive after months and even years of infection. Well, now, in order to make it a bit easier for you to compile all of this into one and try to interpret your results, I'll just put a table here with an example or different cases of combination of EBV antibody levels, and you can just use it as a guidance for you to try to interpret your results, whether it's post-infection or reactivation, which I hope is not. Now, I actually wanted to talk a bit about my experience with EBV testing, what is my picture, what is my dynamics, and I just will leave the test results somewhere here for a couple of seconds, but I don't want to make this video too long, guys, so once again, please go to my Telegram channel and check the full article where I'm describing my experience and how tricky it is with EBV testing, okay? Okay guys, well, the next one, the next approach to testing, it's a bit obsolete, a bit inefficient, I'd say, in advance. It's called heterophile antibodies, or maybe more widely known as Monospot test. Well, what you need to know about this one is that basically it says yes, there's a presence of Epstein-Barr virus in your body, or no, there's no Epstein-Barr virus in your body. The tricky thing about that one is that it may produce a false negative results during the incubation period, like the very, very, very pre-acute phase stage of the disease, where you're just, you know, going around and nothing really happening to you. That's the incubation period, and once again, it can produce false negative results during the incubation period. Then the other problem with that is, according to some statistics, it can be still false negative even in the acute phase of the infection for like 20% of adults and 60% of children. So not really accurate, not enough accurate, I'd say, to even maybe waste your time on that one. And well, the last one from the commonly wide methods which I wanted to tell you about is PCR for Epstein-Barr virus DNA. Sounds a bit familiar from COVID times, right? So yeah, that's a PCR test, but for Epstein-Barr virus. There's a qualitative and quantitative PCR tests. Qualitative basically can show you, like I said, the presence or the absence of the viral DNA in such substances as serum blood, saliva, swabs from oropharynx or genital tract, even leukocytes of peripheral blood. The quantitative can help you to determine the viral load, like the relative volume of viral DNA copies in certain volume of blood. Talking about my experience with PCR for Epstein-Barr virus DNA, I've personally passed this test twice for the last year and a half. The results were tricky, spoiler, it just was negative, but both of the times I felt pretty unwell and I actually passed the tests during that period, but still the results came back negative. One time it was the swab from my oropharynx, and the other one is from the peripheral blood. Both times I felt really unwell, but still it came back negative. So to summarize, I guess the most important thing from my perspective as a person who was dealing and probably who is dealing with EBV for more than 1 year to the current moment, the most effective one is going to be antibodies for you. And you might want to track them maybe on the quarterly basis or on the monthly basis. It's up to you. Well guys, thanks for watching. Hope this was helpful for you. I wish you to test negative, but not false negative, of course. And I just wish you to stay healthy. If you like that type of content I'm creating on my channel, please subscribe to it. Subscribe to my Telegram channel as well. This is how you guys motivate me to keep going and to share my experience and my knowledge with you. Thanks for watching. See you next video. Bye.